Now let's hear from someone who knows firsthand how profiteering middlemen pose a direct threat to the health of seniors. Please welcome Rick Timmins of the Puget Sound Advocates for Retirement Action. I should mention that this group scored a huge victory recently by helping to pass a resolution in the Seattle City Council calling for an end to direct contracting and REACH. Rick, let's hear what you have to say.
Thank you, Dr. Rogers. A few years ago, I enrolled myself in Medicare, and I guess I became a poster elder for what you just heard. Because when I was given that choice between traditional Medicare and Medicare Advantage, the choice seemed to be a no-brainer because Medicare Advantage did offer a number of different coverages that traditional Medicare did not offer, such as vision, hearing, dental, and it had a cap on out-of-pocket expenses. Traditional Medicare was not allowed to do this by law. So I chose Medicare Advantage. A few years later, I came to regret that decision. An old knee injury progressed to the point where it needed a replacement. And I was rather surprised, in fact, shocked, when my primary care advantage company, the insurance company, denied my doctor's request for a referral to a very well-known and respected surgeon at the University of Washington because he was not in their network. A few years later, I had a second cause to regret my decision, and that's when a small lump on my ear suddenly began to grow. It had previously been diagnosed as benign, but the fact that it was growing and painful suggested I needed a little bit of a treatment, and my doctor agreed. She thought that perhaps we needed to consider a melanoma because I've got a family history of that and because of the physical appearance of the tumor. So she submitted a request for referral to a well-respected dermatologist who actually was in the network of the Medicare Advantage plan. Well, if you know about melanomas, you know that effective treatment requires immediate diagnosis and immediate treatment. And so I was rather concerned when a couple of weeks later, we hadn't heard anything from the insurance company. So I made a call to the customer service representative number. I'm not going to go into details, but I will tell you that was the first of frequent, frustrating phone calls and resubmissions of the request for referral, and increasing anxiety and stress on my part, not to mention increasing size of the tumor and increasing pain. So I'm going to jump 9 months later. Now I am recovering from major surgery to remove a malignant melanoma and exploratory surgery to look for metastases in the local lymph nodes. And because of the fact that this tumor was now quite aggressive, I'm now being assessed for immunotherapy. Now, if I had had traditional Medicare, I would have called the dermatologist directly to schedule that appointment. And I would have avoided possibly major surgery, immunotherapy, and certainly the stress and anxiety of waiting. But instead, I had to put up with the choices of the insurance company, who was determining whether or not I should have that procedure. I'm not alone in this situation. Every day, millions of other seniors endure delays, denials, as I did, simply because insurance companies put profit before patients. So as you heard, despite all the evidence that putting middlemen in the middle of the healthcare medical decisions, they drive up costs and they increase denials and delays of care, which can have pretty serious effects on the patients. So the Center for Medicare and Medicaid Services has already begun, as you've heard, to move traditional Medicare beneficiaries into ACO REACH. Now, ACO REACH is not the same thing as Medicare Advantage. In fact, in my opinion, it's Medicare Advantage on steroids. But it is not the same as traditional Medicare either, especially when you follow the money. So I learned my lesson the hard way. And if Wall Street firms are allowed to make decisions about your healthcare, their profits will always come first. Your healthcare will come second. So join me and do everything you can to end this dangerous program before it's too late.